We urge the public to understand that the county government regular briefings on COVID-19 is the only source of verified information in the county besides the National Ministry of Health updates. We urge the public to ignore anyone sharing unverified information on COVID-19 purporting to be from Mandera County on coronavirus pandemic. We are required to report all COVID-19 related incidences, but we have no control over records outside the jurisdiction of the county government. We plead with the public and the social media platforms to be sensitive to the patients under treatment for coronavirus, healthcare workers offering care, and to stop stigmatizing and traumatizing their families. We all want to be paparazzis fighting to be the first to report, yet we are sharing inaccurate information which is dangerous and criminal. As of now, the 2 patients under our care continue to improve. They are doing well. The fever has subsided, the coughs have subsided, and continue to receive medication under the care of our dedicated healthcare workers. As of today, and looking at the improvement over the last 4 days, there is great hope, inshallah, that they may recover fully very soon. Contact tracing of passengers who traveled in the same bus with the 2 patients continue despite challenges of patients who disembarked midway before reaching Mandera, as well as those that do not have phone contacts or their phone numbers were not captured against the manifest. I would like to assure the public that we are making very good progress with contact tracing for the bus and others who may have made contact with those patients. We have more than 30 people in quarantine, but we have no kits with which to send samples to Nairobi. We appeal to the Ministry of Health to urgently avail the kits to enable us forward samples for testing. This situation was occasioned by a presidential order on lockdown of travel into and from Mandera, and subsequently all flights and public transport to Mandera and back to Nairobi are grounded. Ladies and gentlemen, I would like to commend the management of Bulaimpia Nursing Home, which quickly referred the case of the 2 patients to our COVID-19 response center. We urge all private health service providers to emulate the gestures this war against coronavirus requires concerted efforts and isolation to guard against sharing of facilities with other patients. I would like to commend the good job they have done, and we are going to give them a letter of commendation later today for good job that they have done. Finally, countries that have succeeded in this fight against coronavirus are those that practiced early lockdowns to restrict the spread. COVID-19 doesn't spread by itself, but spread through movement of people. As such, we have been left with no choice but to order lockdown within our county. All public transport except those transporting food and other essential goods must be stopped with immediate effect. That includes movement inter-ward, inter-sub-county, and movement between villages. The security teams must enforce this order and mount checkpoints on all roads, including those that are serving other counties and neighboring countries, with immediate effect. Failure to lock down public transport will only mean expectation of mass death within the county and neighboring regions, including our international borders.